Welcome everybody to the 2020 Western Virginia EMS Protocol Update. We'll be your hosts. I'm Dr. Iki.
I'm Dr. LaPera.
I'm Dr. Stanley.
What we'd like y'all to do before we even get going is whip out your cell phone and go ahead and point it up here at the screen. You'll notice a little link pop up there, and that's going to be to download the brand new app that we're going to be excited to introduce you guys to today. We're going to be going through a few features on the new app. We'll also be talking about updates to the document itself. We'll also be going over briefly each of the protocols that changed, and finally introducing you to a new concept of critical care.
The new app offers several upgrades over our current version. Most importantly, the search function has been significantly improved. That should aid in what you're looking for. We have notices now, so the council can announce some changes, and prior versions of the app have now been indexed. So you can search the previous versions if there's something that you're looking for. The standard functions of the app really haven't changed much. The table of contents remains essentially the same. The links and the scrolling function works just as it did before, and the fundamental way that you interact with these protocols has not changed.
So updates to the document themselves, or update to the document itself, anything major we tried to mark with 2020 so you'd know where to go and look. You'll notice minor editorial changes throughout though. We also updated all the references in each of the protocols. We're also excited about some brand new content. Number one would be that critical care concept we just mentioned that we'll go over a little bit later. Also 2 new reference sections, one for all the medications that we use in Western Virginia EMS, and then we did update the pediatric section also.
You'll notice our drug reference is user-friendly. It has pictures of each of the medications we use, along with the use, cautions, and notes about each of the medicines. Our pediatric reference now has normal vital signs. You'll find these at the top of each of the references.
There weren't any big changes to the airway protocol. Some things were made for clarification purposes. This does carry over into some of our new critical care protocols, so if you are a paramedic, check this out.
Hypertension largely got revamped. Labetalol itself was pulled out. The work group really thought that there was a significant risk without much benefit, and it was only used 8 times throughout the entire ground transport in 2019.
For tachycardia, we increased the initial dose of adenosine, so the first adult dose is now 12 milligrams. Second dose remained the same. Pediatric, standard, you're going to start low and then double.
For the nausea and vomiting protocol, Zofran was updated to indicate that it is acceptable to use in the pregnant patient, and remember to get an EKG if appropriate.
In the dyspnea protocol, we pulled the dose of Atrovent down to just 1 pre-hospital, and we also updated the doses of Decadron, made sure it all matched over into the allergy protocol. We also removed LASIK as a medication that really fell out of favor in the past few years. Many national agencies, national recommendations had recommended not using LASIK in the pre-hospital environment.
In allergic reaction, we also reduced the dosage of Atrovent. Only 1 Atrovent pre-hospital. This matches with the dyspnea. We've taken out reference to angioedema to make it more clear and to emphasize the use of intramuscular for patients that are in extremis.
Within the diabetic protocol, the treatment for hypoglycemia regarding D10 has been increased. You may now give up to 5 doses, which is a total of 50 grams for hypoglycemia. Also, please remember to frequently check glucoses and get an EKG for these patients.
OD Tox was also revamped with a brand new table. Makes it sort of easier to locate which antidote you're looking for. It also gave us some space to add a few, including glucagon for beta blockers.
In seizures, previously Versed was an intermediate only skill. That's going to be expanded, but you do need to check with your policy and you're cleared by your OND.
For TXA, we have expanded the indication for this medication to cover intra-abdominal bleeding, but not intrathoracic or intracranial bleeding at this time.
The final thing we want to introduce to you is something we're pretty excited about. It's this concept of critical care. The most important thing to recognize, though, is it is for credentialed paramedics only, and it's also something that your squad will have to sign on to because there's some pretty significant hurdles to implementation. Two of the biggest ones is you're going to need to develop a pharmacy to be able to get all the medications that are required for it. You also need to make sure that you have comprehensive physician quality review. And as a provider, you'll have to go through a regional in-service, and that's to be determined. So if you're interested in this, talk to your training officer. If you are the training officer, go ahead and shoot off an email to western@vaems.org, and we'll send you some more information. So thanks for watching, guys. We hope you enjoyed this very brief video introduction to the protocols. If you're ready to get going with the new 2020 version, just go ahead and open up a browser with the link down below. You'll get the attestation form. Go ahead and fill that out. Sign it. Turn it in to your training officer, but make sure that you are actually cleared to start using the protocols before you start using them. And then also thank you very much to everybody over there on the back of the book that helped us out with all of these updates. And especially for the EMS members, if you are interested in being a member of that work group committee that helps update the protocols and introduce new concepts, please email western@vaems.org. Thanks so much.